Okay, so this is week 8, upper extremity week 8, getting into the thumb arthritis, also getting into trigger finger and Dupuytren's contractures, very common things you see a lot in hand clinics, outpatient clinics, issues around the thumb and Dupuytren's and trigger fingers. It'd be good to review the anatomy. There's a PowerPoint on the anatomy of the thumb before you get into this, so it'll make a lot more sense. Here's your learning objectives for this week. Okay, so this is our case. This is Beth. She's an OT student. She's into thumb wrestling at Mason's. That's how she's pays for education. She's got pain in the base of her right thumb, difficulty grasping, pulling on objects with her thumb, pain especially when using her takedown move. I'm guessing is like a thumb MP, IP flexion kind of thing. Buttoning blouses, writing, sometimes when even holding her big Pedretti book. She's getting this snapping sensation in her index finger. What could that possibly be as well? So you can figure out what we can do to help her out. Okay, let's just kind of review arthritis a little bit, which is usually the big culprit with the thumb. It's usually arthritis in that CMC joint. So you look at this image right here, you can see how the whole cartilage and fluid of the joint just kind of erodes, the lining of the joint just kind of erodes through the arthritic process, especially with rheumatoid arthritis. And it just gets to the point where it's bone on bone. Definitely think of space and flow issues. It's just grinding bone on bone. Definitely that happens in the CMC joint in the thumb, and commonly in the hips and knees as well with a lot of people. Here's that CMC joint. And this is the joint that's down way in the base of the thumb, not the MP joint. They're going to get confused with the MP and the IP. CMC is way down in the base of the hand. This is where all the arthritis happens. This is a good picture of a degenerative carpometacarpal joint. And sometimes they, they do implants. They put like an artificial joint right in there. Here's an example of there's the CMC. See, it's like a saddle joint because that thumb joint just goes everywhere. Makes it highly vulnerable to injury and arthritis. And they're just putting a tendon in there to kind of replace it. How do you know if somebody has CMC arthritis? How can we tell with this? Commonly pain with gripping and pinching, swelling. This is the CMC way down here. Swelling down there, tender with palpation, deformity, hyperextension of the MP. See right there, kind of hyperextended. The grind test, we'll do that in lab. That's a good test. It's not a definitive test, but kind of give you some clues as to what's going on. Early stages of arthritis, stage 1 arthritis, will not show up on X-ray. You have to kind of do some deductive reasoning to kind of figure that out. Deformities with arthritis, the swan neck deformity. This is usually the swan neck and the Boutonniere. They're around that PIP joint. Here we have hyperextension. Hyperextension of the PIP joint, proximal and phalangeal joint, leads to swan neck deformity. Kind of has this characteristic look to it, very characteristic of arthritis. Boutonniere deformity, it's kind of the opposite. It's a hyperflexion of the PIP joint. Here's some of the deformities again, osteoarthritis, later stages. You see these nodes, little bumps, swelling of the joints. Rheumatoid arthritis can get really severe deformities if you've ever seen that with patients. Rheumatoid arthritis usually affects both sides at the same time symmetrically. Wrists, hands, elbows, knees, ankles, all those joints. You have to be really, really careful as an OT when you're working with somebody with rheumatoid arthritis, because especially with the hand, with those vulnerable little joints, you can actually do more damage than good. In terms of stretching, even stretching passively, you have to be really careful about that. You can cause deformities in these joints, especially if it's flared up. So really, really careful about that. Osteoarthritis, not so much, but rheumatoid arthritis, really have to be careful about joint deformities. This is what they call an ulnar drift. You probably heard about this. It's drifting towards the ulnar side, all the joints of the hand. This person has an ulnar drift, this image, swan neck. See this hyperextension of the PIP, so all the way across. The Boutonniere there. Here's the swan neck again, the hyperextension of the PIP. DIP is flexed. There's the normal joint, and then there's the swan. Again, it's sagging kind of down. And the boot is kind of going the opposite way. It's flexing of the PIP, going up. And what happens with the BIP, the PIP hyperextension, with the Boutonniere deformity, is it can eventually snap this tendon, this EDC tendon, extension digitorum communis, that goes all the way out. It extends the digits. It eventually can get to the point where it will snap that tendon, especially as the person gets older and it gets more vulnerable. There's the Boutonniere deformity there as well. Finger joint replacements, they do that in the different joints if the arthritis gets really bad. We'll look at the treatment box